I want to talk about something beside the Affordable Care Act, but it's a health-related issue, and it's hunger among the elderly in this country. And it is an issue that I am passionate about and have written about for the nation, and it is being totally ignored by my brethren in the press. People need food to eat. Elders need food. They need food for health. It's the basic building block for good health. And what we have in this country are waiting lists for Meals on Wheels programs all over the country. Now, can you imagine an 82-year-old or an 85-year-old, number 400 on a waiting list in Louisiana or Indiana or wherever? They're all over. I investigated all of this for the nation last year, wrote about it, talk about something that is so impactful and should not be happening in a country with the resources that the United States has. And a lot of people on Medicare are in this fix. This one man in Baltimore said to me that he did not have a supplement, a Medicare supplement. He couldn't afford it for him and his wife. And he had been on the meals program in Baltimore County, but he had to get off of it because they couldn't afford 2 meals. So, and his wife wasn't eating it anyway, so he was only on 1 meal. And several months later, the social worker went back there and found that he had also dropped his meal. And she asked him how he was managing. And he said, well, I do the best I can, but some days the best isn't good enough. And I think that this is something that is so basic. You can't, I mean, before you can even get to insurance, you have to have food. And every time I've mentioned this to people in the managed care industry and say, why don't you have these food programs? They say, oh, this isn't anything that we're interested in doing. So that is the one story that I think needs to be written and is not, or told, and is not being told.
I think it doesn't specifically deal with the hunger in the elderly, but the documentary Place at the Table, I think, is if you have not seen that, is a terrific film about working families trying to cope with, you know.
Well, these people can't work. They're elderly. They are.
No, right.
You know, they're retired. They're the very old people, and you know we want people to live longer, right? But by taking all these medicines that
and part of this is all supposed to be about prevention.
Exactly.
And
well,
there
they're
seem to
not
be huge
preventing
gaps.
very much here.
No, exactly.